Hey everybody, it's Dr. Kelly. I want to go through and give you a brief overview about how you would get treated as a headache patient here at Divine Spine. Now, a lot of people suffer with headaches. It's really prevalent, particularly when you get people that work at computers all the time, people that are stressed. These are really, really common things. There's also a type of headache called a cervicogenic headache, which essentially means that the spine itself, the cervical spine, isn't moving properly. So when the spine stops to move, we start to get muscle spasms. Muscle spasms, of course, create nerve impingements, and that can lead to some really nasty headache things. So I'm going to show you, just so you know and know what to expect when you do become a Divine Spine patient, what you would expect when you got here. So this patient comes in, she's got some headaches. I'm going to show you how I'm going to treat that. I'm going to use just a little two-prong head. You can see she's completely relaxed, and we're going to start to do some really, really light, I want you to look at this. That's how light it is. It's so light that basically, think of it like a little woodpecker just chipping away. We don't need a huge force. It doesn't need a huge force in order to get the results we want. So first thing we're going to do is we're going to start to adjust through the spine, and we're going to adjust this patient so that we know we're having, every time you hear that little beep, that's motion back in the joint, the specific joint that I'm working on. So I've just actually adjusted her entire cervical spine, which is convenient because she actually does have headaches. And now I'm going to look. She's got some muscle hypertonicity through the suboccipital area, which is way up high. So we have a really specific protocol that we use in a really soft, big head. And we have a very specific protocol that we use right along the suboccipital area. And this really helps the muscles start to relax. I'm going to do both left and right sides, of course. So, I'd probably do some more range of motion exercises with this patient, but essentially what you can see is this treatment itself is incredibly effective, incredibly safe, and it's not traumatic to the tissue. So I may ask her to go home and ice later because she's so relaxed and it is so effective that we get a lot of a tissue motion with very little effort, which is great. But you can see if you yourself or somebody you know suffers from headaches, you owe it to yourself to come on, try out a Divine Spine as a patient, see what we have to offer you. I can assure you, if you've never tried a Divine Spine before, you owe it to yourself to try. I'm Dr. Kelly. I'll see you on the other side.